Okay. Good? Okay. And don't worry, you can get the handouts, afterwards, because I have a bunch of them. But also, this way you can leave with something as well. Okay. You're a good student. You're a good student. You sit right here.
I didn't recognize you with that long hair. I don't, it's just incredibly long now.
It's just decided to grow, and the sudden it's just crazy.
All right, we're going to get started. We are videotaping this today just for when people can't come or, they may not need the information right now, but maybe need it in the future. So we're videotaping this session today to go on the internet. So first, I'll introduce myself. I'm Stephanie McKee. I'm a licensed clinical psychologist. I'm also a senior director of program development and analysis at Hospice by the Sea. One of the programs I oversee is our Caregiver program. And I was telling earlier that people don't realize Hospice by the Sea, that we're located in Palm Beach and Broward counties, that we have a separate caregiver program that's not related to hospice. It's for everyone in the community, because we really saw the need that caregivers need support well before they need hospice services. And some people never ultimately choose hospice services. So I'm here to talk to you about that program. We received a grant from United Healthcare to support us going to companies in the community, because there's so many more working family caregivers. And they have a challenge going to things after work or going to things on the weekend to get information, and also don't know about the information. So you're very lucky your HR department here really recognizes the need, because this is something that most companies aren't focusing on, but it's a growing issue. So we'll get started, and I'll make time, make sure we have time to ask questions. These are really, and I'll go over everything in case it's hard to read. You all took the survey. We had the survey we put out, I think, a couple of months ago. And so these were the top topics identified in the survey that we're going to go over today. Benefits available through the city that will maybe assist the caregiver. And we're going to be having someone from HR come in at the end to review some of those. How to communicate with healthcare professionals. Community resources that can assist you. Legal, financial, healthcare planning. Coping with caregiver responsibilities, and using complementary therapies and other things for stress management. And again, it's really good that City of Wellington, you have a whole wellness initiative, which again is very unique as well. So just to tell you, there's a lot of information we're going to go over, because each of these individual topics could be a presentation in and of itself. So I don't mean for it to be overwhelming. Just want to give you a little taste of all the things to give you information, and then you can either by contacting me or our caregiver line or talking to me afterwards, I can give you even more information on the different topics. Okay, so caregiving really is a public health priority. Even in 2007, the Centers for Disease Control recognized it as a public health priority. And the American Medical Association actually is now recognized as caregivers as the patients behind the patients. Okay, and they're even trying to push physicians to screen caregivers who may be at risk, for stress, different things like that. So it's really a growing issue. So what is a caregiver? Someone who provides assistance, but not just assistance, usually unpaid assistance, to anyone who is in some degree incapacitated and needs help. So that doesn't need to be someone who's elderly. It could be a child with a disability. It could be a spouse. It could be a neighbor. It could be a friend. And so often people don't label themselves as caregivers. So it's important to recognize yourself that you are. And caregivers are really wearing multiple hats. And in addition to your working, you're taking calls that maybe your mom fell at the facility during the day. You're having to manage medications, drive to doctor's appointments, which isn't just driving, it's sitting waiting in the waiting room for an hour or 2 hours. Grocery shopping, maybe making repairs around the house, on the phone, arguing with the insurance company. All these things take a lot of time and a lot of energy. There are positive aspects, obviously, of caregiving. It really gives someone a sense of satisfaction that they're doing something for someone they care about. Sense of pride. I had one caregiver that she really took pride in the fact that she took care of her mom at home. Her mom had no bed sores. Her skin was in perfect condition. She took a lot of pride and a sense of satisfaction that she was able to give back to someone that cared for her whole life. Gives you maybe a sense of confidence. You learn about your abilities and strengths, sometimes things you didn't realize that you had in you. And for some, it gives you a sense of purpose, that you're doing something. Just some statistics so you can see how prevalent this is. There's more than 65 million people, 29% of the US population, that provide care in any given year who are caregivers. They average about 20 hours of care a week, which is equivalent to a part-time job. And there's really no limit or end to how long this can go on. It's unpredictable, especially things like dementia, for example, go on a number of years, a lot of ups and downs. So it's unpredictable how long it could last. And it could be you're in one caregiver situation and then another one begins. Caregivers' efforts are valued at $450 billion a year and make up about 80% of all home care services. And a number of caregivers are providing direct nursing care, a role that they often don't get training on, education on, which causes them stress, which causes them to maybe do things that could cause them harm or injury. So also, the average caregiver situation, as I said, lasts 4 years, but it can really vary. A number have no choice in taking on the care. They may be the only sibling, the only friend, neighbor. Other kids or other siblings, for example, are out of state or in disagreement with the person that they're caring for. There's a lot of family dynamics that play in. Majority are women, and people don't realize there's 1.4 million children ages 8 to 18 who are also in a caregiver role in addition to going to school. Working family caregivers, majority of caregivers work. There's a growing number of caregivers in that baby boomer population. They tend to have to make changes at work, whether it may be going from full-time to part-time, not being able to accept promotions, different things like that. They lose an average of $659,000 over their lifetime as a result of those things. Okay. Or maybe having to, take time off without pay, all those sorts of things. There's really been an increase in the workforce of caregivers, and it's only going to continue to increase over the next 5 years as we see the increase of the baby boomer population. And it really affects everyone. It doesn't matter what position you are, what level you are. And typically, caregivers who are working handle it silently because they're afraid, especially in these economic times, to let their employer know about it. And they're concerned their employer is going to think that they're not able to do their job. So this is a good step, especially in the city of Wellington. It's showing that they feel like this is important and they want to support employees. And again, it affects both the caregiver and the employer. For the employer, if someone comes in late to work, if you're having to take calls during the workday, it obviously affects work as well. And research has shown caregivers are less healthy compared to non-caregivers. Stress that they experience affects them. Again, maybe they're doing things like if someone goes to fall, they try to catch them. That may cause them injury. They also neglect going to their own doctor's appointments because they're taking that time off or that sick time to go to the appointments for their loved one, and they neglect their own health. Also, if caregivers have a chronic condition themselves, like diabetes or something, they may no longer manage it correctly. So there's a number of ways that their health is affected. They have higher levels of depression and anxiety, and research has shown even increased mortality because of all these stressors. Okay, so this was one research study that actually a employee assistance program did, and their research found, I'll just read it, a troubling trend of baby boomer caregivers being pushed to their limits. They're worried about their ability to manage both their work and home life, and they hope through their efforts to raise awareness among employers about this risk to their employees' health and productivity because they play a key role in bringing workers' lives back to balance. And that's why we're doing this project. And just quickly, findings of the study they did, they found that those ages 45 to 54 carried the largest burden. A number of them were worried about how it impacts their job. A number reported having to miss work. Those are some of the questions we asked on the survey. A number are worried that they're going to have to postpone their retirement. They report, and we saw in all the studies, not just in this company or this organization, having to take vacation time to take care of a loved one instead of taking that time to get a break. And they really take more leaves due to illness. Okay, this is one of the overwhelming slides. So I'm just going to go through kind of each one, because these are really key resources that people don't know about. First, I'm going to kind of skip around a little, but people don't realize there's respite programs. What is respite? Respite means something that can give the caregiver a break. There are a number of these programs in the community. That could be a break of even an hour or two. There's a lot of volunteer-based organizations in the community that a trained volunteer can come into the home, give someone a break, that they can go to lunch, for example. There's other respite programs, and even I think through the VA, there's some respite programs where someone can get up to 30 days of respite each year, allowing someone to go on vacation. So people don't realize that there are these programs that are out there, and again, a lot of volunteer-based ones. Home health services. There's a lot of home health agencies. And social workers, nurses, a lot of the physicians' offices you go to will know about these things. And a lot of the resources I'm going to give you, and I have a resource list, give information about this. But home health services are typically when someone has certain restrictions that they can't leave the home. They can still go to some doctor's appointments, but a physical therapist, nutritionist, nurse will come to the home. And again, it depends on your insurance about what's covered, what's not covered. So a lot of these are insurance-based. Adult daycare, especially for Alzheimer's. There's a number, in our community of locations that provide this. Even like Mayvolin, which is, further down south, they provide transportation even, where someone could be picked up during the day, taken to the adult daycare center for Alzheimer's care, for example. So these are things that are, very important. And of course, you want to look into these places beforehand and to see what they offer. But again, this is resources people don't know about. Skilled nursing facilities, so often people sometimes have to get into that situation of making the decision whether someone that they care for can no longer live in their own home. You'll hear different names. There's independent living facilities, which means someone can live independently. There's assisted living facilities, which means for the most part, someone's living independently, but there's 24-hour assistance available all the time. Skilled nursing means that someone really needs more of a skill, maybe more rehab, things where they need more assistance. And again, the challenge with all these things is insurance coverage, and I'll talk to you a little bit more about that. There's also continuing care retirement communities, which are a little bit more pricey, but they're places you can buy into, and they have all levels there. They have independent living, they have skilled, they have assisted living. A lot of them also sometimes have a medical center. They have sometimes even a hospice unit. So that means you buy into there, and then you never have to end up leaving that community. Everything's all there, but it is more costly to buy into that. It's kind of an investment. Private care aides, private duty aides, that's something that typically, unless you have like a good long-term care policy, most people are going to have to pay out of pocket. Sometimes that is a challenge that your loved one needs 24/7 care, and that's when you have to think about facilities as well. So that's something to think about. Know it's out there, and there's different levels in terms of cost. You can have just an aide. You can have someone who's a registered nurse, a licensed practitioner. There's some people that you may know from your church spiritual community that can just come in and help, but they're not going to provide that nursing care. There's also when you're in the hospital, let's say this happens a lot for someone who's taking care of someone for a distance. There's private care manager companies, patient advocates that I've known of a family who, they were in New York, they hired someone that literally, this individual went to all the medical appointments with this person, managed the person's care. Again, it's a resource out there, but all of these, it's the cost-wise factor. People don't realize if your loved one was a veteran or their spouse was a veteran, there's a lot of VA benefits that they could be eligible for. And even as a caregiver, if you go to the VA website, there's a lot of caregiver resources that the VA has. They have a whole caregiver program, actually, that they offer if your loved one's a vet. And it includes education, the respite I talked about. They have a whole program they've now put in place. And there is a VA, up in this area. For some, their spiritual community, get that support. Caregivers, oftentimes, they have people from their spiritual community, bring meals by, can stay with their loved one. Hospice is another resource when it comes to that time. People think hospice is just a place you go to die. That's not the case. If someone qualifies based on their diagnosis with the criteria of 6 months or less prognosis, and they choose to stop aggressive treatments like chemotherapy, dialysis, they can qualify. People end up being on hospice for years as long as they continue to qualify. And the majority of hospice is actually offered in the home. 90% of people on hospice are in the home, and people actually do get discharged from hospice. There are hospice units as well. And it's really a relief for the caregiver, because hospice services, especially if someone is of Medicare age, are covered 100% under Medicare. People don't realize that. And they can bring medical equipment to the home, medications are delivered, oxygen is there, but we're Hospice by the Sea, we're a not-for-profit. So that means, well, number one, we accept all insurances, Medicaid, Medicare, but also regardless of ability to pay. We take individuals. So hospice, and I have a booklet about hospice services, because it's something people have a lot of misconceptions about. The Area Agency on Aging is a really great resource as well. We have one here in West Palm Beach. You call them, go on their website. They can really help you with a lot of the community resources. But not everyone's caring for someone who's elderly. So there's a lot of resources too, like if you have a loved one that has cancer, the American Cancer Society, go to their website, call them. All these places can then direct you to the right thing, and sometimes it's helpful to have that disease-specific support. There's an Alzheimer's Association. All these places can help you specifically, and they're very knowledgeable. Support groups, caregiver support groups specifically. We have support groups also, and the focus is really on the caregiver. Caregivers neglect their own self-care. And they also need tools, and they're experiencing feelings like guilt, things they feel badly about that they are experiencing. A lot of volunteer-based organizations, a lot of resources on the internet. I'm going to give you a handout that gives you some good websites to go to. And I'm also going to have a handout about our program that we offer. So again, as I said, a lot of information, but just know these things are out there, and I'm going to give you some good resources that you can get some more information. There's also other services in the community that people don't realize could be free. For example, there's different housekeeping, cooking, companionship that are volunteer-based, or sometimes even the power company, can come, or they can do a safety inspection. I forget, one of the companies, they can come in and do an evaluation and make recommendations of, okay, you should have this bar in the bathroom to help your individual. And they can look at that whole environment, especially if you're dealing with someone with dementia. It's a concern. You don't want them going out and wandering. So there are services out there, even meal delivery based. For cancer, there's also, I think, free meal delivery programs, different things like that. So these are out there. Just need to, find out about them. And again, I have some different resources. In terms of paying the bills, if your loved one is Medicare age, which is 65 years or older, Medicare doesn't cover for like a nursing home. They don't cover that. There is, things like Medigap, other things that you can get to help cover, but looking at a good long-term care insurance policy and getting it sooner than later is important. And again, you don't have to be elderly to be looking at this. You should be looking at this when you're age 50 or so. There's, HMOs out there, Medicaid, also Medicaid, you have to qualify based upon your financial situation. As I mentioned, the Veterans Administration has a lot of benefits available. Sometimes it's a lot of paperwork to go through getting those, but it's important to look into it. I met a family yesterday, they get $900 a month just from the veterans benefits. That helps a lot. And like I said, Medicare, covers things like hospice as well, 100%. There's supplemental insurance that you can get. Each insurance policy is different that you have. Long-term care insurance, as I mentioned, and I'm going to talk on the next slide or in a little bit about where to go, but it's good to look at those plans. And unfortunately, like I said, some of the services, especially private duty aides, are out-of-pocket private pay. So there are if you're dealing with someone who's elderly, there are elder law attorneys. And this is a very specific type of attorney, and there's not a lot of them, but it's good to go to someone because they know specifically how to deal with elder care. And they can do all the things that, they can do power of attorney, advance directives, estate planning. They can do all of that. In general, going to an insurance agent, meeting with them, learning about long-term care regarding no matter what age you are is important to do because you never know when someone's going to be in that situation, no matter what age they are, that they're going to have to be in a facility. Financial planners to help you plan ahead, accountants, there's a lot in terms of taxes and things like that people want to make sure in their will is taken care of, and a representative payee. That means when someone is eligible for Social Security, in order for you to receive the check, that's what you become. Okay, so one thing I want to emphasize is advanced care planning. Have you heard of advanced directives, like living will, healthcare surrogate? Okay. These are really key. You wonder why someone like Terry Schiavo was in the news. Well, a lot of it was, she was in her 40s. She didn't have this kind of piece of paper. So there was a lot of disagreement amongst her family. There's nothing unique about her case besides the fact it was brought to the legal level and she was in this age group that's very vulnerable. And I see this all the time because I work in the hospitals with patients. Advanced care planning really is that process of talking to someone about their wishes. And it's called advanced because it should happen now. I teach at the medical school at FAU, and in their first year, the medical students are learning about this. And they actually practice completing one for themselves at age 20-something, and they learn how to talk to patients about this. So this is very important. And you really have to make sure the person who you want to decide for you is the right person. It's hard when you get to a certain point to make each individual medical decision. So you need to know what someone's goals are. If someone's goal is, I want to be comfortable, I don't want to be on a machine, for example, that's important. If someone says, do whatever you can until the very, very end, that's important. And advanced directives, which I'll talk more about each one, they don't come into play until someone's no longer able to communicate for themselves. But that's important because sometimes there's family dynamics. If you don't choose the right person legally to make the decisions, there's going to be a lot of disagreement. Or the caregiver may be left with the stress of not knowing what their loved one would have wanted. And I have some sample advanced directives that I'll show to you. Okay. So it's really a written or oral statement that's made and witnessed in advance of a serious illness or injury about how someone wants the decisions to be made. And it's something you don't have to go to a lawyer for. You can get printed off the website, a living will. And in the state of Florida, they don't have to be notarized. They just have to be witnessed. So a living will is the first part of an advance directive. Living will is not the same thing as a regular will. Living will talks about someone's wishes when they're no longer able to communicate. Do they want pain medications? Would they want a feeding tube? Would they want to be resuscitated? All these things, and they're hard things to talk about. Right now, I talk about it. I don't have one for myself. I should. God forbid I was in a car accident tomorrow and was no longer able to communicate. My husband probably wouldn't know what I wanted. So I need to have that conversation. So it doesn't matter what age. And in the advance directive I'm going to give you, 5 wishes, it's a really even more thorough. It talks about, what would you want your funeral arrangements to be? And again, hard discussions because it seems kind of morbid, but I've seen family members struggling. I don't know, would they want to be cremated? Would they want to be buried? I don't know what they would have wanted. So it relieves a lot of anxiety for the caregiver. Again, hard conversations. And again, the state of Florida, you don't have to go to an attorney, and it just needs to be witnessed by one person. Can be a blood relative, the other cannot be. Okay, and it's important to keep copies of this in a place that's accessible. Sometimes when I'm in the hospital, there's people that say, oh, I have it back up in New York. Well, that doesn't really help unless you can get it immediately. Designation of healthcare surrogate is very, very, very important. This means you're choosing a certain person to be your decision maker when you're no longer able to. That person may not be your spouse. Your spouse may not be emotionally able to make those decisions for you. Sometimes someone may have 5 children. Those 5 children they know their whole lives have never been in agreement. Some people in their healthcare surrogate, they say as long as the majority of the children agree, or they say I want this person. Some people, you're in a significant relationship, but you've never been married. If you don't choose that person in writing, legally, according to the state, that person is very, very low on the list of who'd be the decision maker. When someone doesn't designate someone, the state of Florida has, it says, first is someone's spouse, then is someone's parent, then is a child. So it goes in an order, and friend is at the very, very bottom. So you need to really think about these things. And do not resuscitate. Again, these are things, do not resuscitate is something that's more when someone really is more towards the end of life, but it's something to talk about. It's really, if you're in a situation where you had to go into cardiac, pulmonary arrest, respiratory arrest, would you want to be resuscitated? And what's also important is if you have someone in a nursing home, for example, who is very frail, who is very, very sick, unless you have what's called an outpatient DNR, a yellow form, they will have to be resuscitated. You probably heard about that story in the news a month ago or so about that nursing home situation where they didn't resuscitate them. If an ambulance comes to your home, if someone goes into arrest, they will automatically, legally have to resuscitate them, even if you say this person wouldn't want this. So this is a document to have, and it's specific to the state of Florida. Just needs to be signed by the person and by a physician. And you can go on the State of Florida website to hear more about this. And there's different barriers to completing advance directives. As I said, people just procrastinate. I mean, look at me. You think, oh, I'm young. Nothing's going to happen to me. It's a difficult conversation to have. And the belief that you have to be elderly at the very end of life to have these discussions and complete these documents. And people don't update them also. So some people may be completed and then they have their ex-husband listed as their decision maker, not maybe what you want to have. So it's important to update it. And also you may be in a certain situation now where you're healthy and you'd make certain decisions, but God forbid you're diagnosed with something, you may change your mind. So again, that's important. Another thing that came up on the survey was communicating with healthcare professionals. What are some of the challenges that you've had with communicating with healthcare professionals?
Just speaking with them, they just
In and out?
talk in layman's terms.
Okay, that's true. And so part of it is finding the right physician. Some physicians, they go and they really take that time to talk to you and care not just about the diagnosis. Others are in and out. You have a right to choose the right physician. Sometimes it's the nurse practitioner or the nurse in the office that will explain things more in layman's terms and will be that better contact for you. Or just ask the physician questions. Sometimes we feel intimidated and don't ask the physician to explain something further. Sometimes it's helpful to go on the internet for more information, but that can also cause you to get more stress because you're learning about things that may not apply in your case. Other things that come up, with physicians now and the insurance pressures they're under, you may feel like, well, there's no time to bring this up. I feel like they want to be in and out. Again, then in advance, call the office and say, I have some questions for the physician. Is there a better time of day to schedule the appointment? Or is the nurse going to be available? Like I said, a lot of times those nurses, nurse practitioners are going to be your best resource. And they communicate back and forth with the physician, but they're there to really answer those questions, to have a little bit more time to do that. Sometimes it's the challenge of reaching the doctor. They don't even call you back. Or like I said, you feel like you're bothering them. It's important to go into an appointment with those questions listed, especially if it's a difficult or stressful appointment. And also to take notes or sometimes take someone else with you, and because they may absorb the additional information. As a caregiver, it's key to go with your loved one to the appointment if you're able to, because they may not be able to ask the right questions. And this way also there's 2 sets of ears hearing the information. Okay, because again, people are stressed, it's hard for them to take in the information. keep records of your loved one's behavior. Sometimes it's helpful, to write down. I mean, I saw one person, she was actually the director of HR at another organization. She pulled out her whole journal where she keeps track of her mom's eating, her mom's sleeping, what her mom was able to do, and you see trends there and patterns because it's sometimes hard to remember. And when you're with someone all the time, it's hard to see a decline because you're just with them all the time. So documenting these things is important. And again, ask questions, learn about the illness. For example, with Alzheimer's, family members have said, the person gets very agitated at me, they take it personally, and they don't realize it's part of the disease. So see what's part of the disease and what's not. And again, I forgot, children are in the same, everything, this of what I'm talking about applies whether it's a child, an adult, any age. A caregiver is a caregiver and they deal with the same stressors and there's different resources.
I'll tell you something I've learned over the years is, and it's sad to say, but I don't trust doctors anymore. From where I come from, people in that position are just, whatever they say, you take for granted because they're professionals. In this country, I've noticed their motivations are different than what they are in my country, where I came from. You assume that they're interested in treating whatever condition the patient has, and later you find out that really they're interested in the dinero. And I don't trust it. When I go to a doctor's now, I listen to what they say, I take notes, and I don't make any decisions there. I go and research on Google or whatever it is and find out, because too many times over the 32 years we've had our daughter, I've found out later that the stuff they've given her has actually made her worse.
That's a very good point, because I can speak to, my father. He just recently, went to a surgeon. He was diagnosed having like a melanoma, skin cancer. This one surgeon wanted to be very aggressive, wanted to schedule things the next week. He just had this gut feeling. He just didn't feel comfortable with this person. He actually decided to go for a second opinion. The surgeon called him and started yelling at him, "How dare you question me?" That was even more of a sign not to go with this doctor. He went to another doctor. Turns out he didn't have to go through any of those aggressive things that the first doctor was recommending. So be your own advocate, and even going to different specialists. Each specialist will tell you something else because they're coming from their little, tunnel vision. It's hard. You almost have to be your own doctor, your own advocate. I mean, how many times you hear about someone who they went to this one person, they said, there's something wrong, there's something not right, and, they're like, oh, no, it's fine. And then a year later, they find out it's cancer. And it was missed because it was dismissed. Always go for a second opinion. If you're not comfortable with a doctor, go to someone else. My primary care physician, I go and he's asking me, oh, how are you doing? How's work? And sometimes I don't even answer him because I feel like I can't take up his time. But meanwhile, the reason he's always running a little late is because he's taking that time. That's the kind of physician you want to go to. And you can get a feel, and you get a feel from the office too. How the office responds. They're able to get you in. They call you back. So shop around, and you have to be your own advocate. And as a caregiver, even more, because sometimes your loved one, or especially a child, they're not able to be an advocate. So it's a lot of work as a caregiver to get that right information. Caregiver stress. Obviously, caregivers, as we talked about already, everything we talked about is on your plate leads to stress. The financial pressure, also for some people, it's that change in roles that you're caring now for someone that used to care for you. If it's a spouse, for example, maybe there's things you used to do together. Go to the movies and then come back, talk about, or go out to dinner with friends, and things now you're not able to do. There's really a lot of uncertainty when something will end. If you're dealing with cancer, for example, there's a lot of ups and downs, waiting for the next scan, what are the results, weighing the benefits of, treatment versus the side effects. You often don't get that time alone, and you don't get to continue to spend that time with friends anymore, and you kind of isolate. And other things that influence stress are your own abilities to cope. Typically, how you deal with something. Are you someone that, then you start smoking more? You're someone that you go for a walk? How do you cope? The caregiver situation, sometimes, as I said, people just put into that role, even though maybe they've had a very tumultuous or difficult relationship with the person they're caring for their whole life. And whether it's voluntary and whether you have additional support, whether it's just you or there's other people that are good support for you. Now, if you don't pay attention to stress and those initial signs, which we'll talk about in a minute, this can lead to caregiver burnout. It's almost like the symptoms of anxiety and depression. And not going to go through all of these, but really, some of the physical signs, you have those changes in appetite, either losing weight, gaining weight, trouble sleeping, you're more sick, you're feeling kind of hopeless, helpless, you maybe start to get more irritable at your loved one or at other people who are close to you. You feel angry or resentful that this person, and you feel guilty for feeling this way, but you're like, sometimes I just want this to end so I can then have my life back. So there's these feelings that caregivers experience. They feel overwhelmed, really feeling negative about the caregiver responsibilities and the role they're in. So this is at the point where it really starts to interfere with your functioning and who you are as a person. We all experience stress, and even work. You hear about work burnout. If you don't address things at a certain point, they're going to lead to this. And when it comes to work, there's specific symptoms that you may see at work. You may be less effective. Your mind isn't being able to focus. You may be absent more. You're not as productive at work. You're maybe more harsh in dealing with coworkers. You, again, have that trouble concentrating. There's things that may happen that aren't burnout. Again, everyone who is a caregiver has to answer calls during the day, or maybe their lunch break, make certain calls. But these are things that really are affecting you as a whole person and how you interact with other people. So asking yourself, do you need a break? And sometimes you don't recognize these things. It's someone around you that recognizes these things. Do you have a short fuse? So are you just quickly jumping on someone? Emotional outbursts, like really crying very easily. It's okay to cry, but really crying like very easily, for example. As I said, the problems sleeping, problems with weight, just really dragging, being very lethargic, having a lot of physical ailments, socially isolated, asking yourself really, when was the last time I went out and did something with anyone? And is your family complaining about you and how difficult you are to live with, for example? So these are just some things. If you answer yes to the majority of these things, you may need a break. And probably most of us in this room need a break. So the hard part is actually then doing it. Okay, so burnout prevention, the first thing is recognizing the warning signs that you are stressed and identify the sources. It may be a certain aspect that's causing you stress. Seek out social support. And some people may not be supportive. And then, if there's a friend that calls you and causes you more stress, well, maybe you need to distance yourself from that friend if it's causing you more stress. Also, delegate. People always ask, is there anything I can do to help? Yes, sometimes people just ask that, but some people also mean it. So find someone, like I had one individual who was a caregiver, and her husband was the one that took care of all the accounting aspects, all the financial aspects. She knew nothing. She had a friend who was an accountant. Her friend who was an accountant was able to come in, help her. If someone's going to the grocery store already, if they pick up a few more items for you, what's the big deal? So knowing that it is okay and it doesn't mean you can't handle things. If you need to, seek that professional help. See a social worker, see a psychologist. There's nothing wrong with that. And sometimes that's helpful for people to do because they feel like they can't talk to the people close to them about the stress they're experiencing. And like I said, there's also caregiver support groups. Learn hands-on skills, and I'll put out also, we have a DVD that just talks, and some of the things you may not be ready for yet, but it talks about fall prevention, how to move someone into bed if you need to do that, if someone's in that situation, those types of tips. Really get educated about the illness. That's really key and important. And identify the community resources, which is what we're talking about. Know what your limits are. Too often we say yes, 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 yes. People that are in a caregiver role put themselves second. You need to see the importance of taking care of yourself and learn different stress management techniques. Recognize what you can and cannot change. You want to feel like you have control. So focus on the things you do have control over. You don't have control of the results of your loved one's tests. You don't have control that someone was born with a certain ailment. Focus on what you do have control over. And recognize all that you do. So often caregivers don't give themselves that pat on the back and that appreciation, and they're hard on themselves. So healthy ways to relieve stress. Ask yourself, what are things that I enjoy doing that maybe I haven't done in a while? If I had extra time, what would I do? And things don't have to cost money. You can just go to the beach. Let's say you haven't gone to the beach. Take your book, read. Even I had someone who golf was what they enjoyed doing. But this caregiver lived with their mom. She had dementia. He felt like something horrible would happen if he left. Plus she kind of gave him a hard time when he wanted to leave. And didn't want to stay with anyone else, didn't want anyone else to stay with her. So rather than going to play golf for 4 or 5 hours initially, he went and hit some golf balls for a half an hour. God forbid something happened, he has the phone, he's close by, and we taught him some skills with how to deal with that situation when his mom starts being kind of not so nice to him when he tries to leave. And eventually, he ended up playing golf because it's reinforcing. You do that little half hour and you see, why aren't I doing this? I feel so much better. You feel more replenished than go back in the situation. And again, they don't have to cost money. Do what works for you. But one of the things on the survey that mentioned was complementary therapies. Those are things, probably like massage, yoga, are the things that you hear the most about. They complement maybe other medical treatments. They really are a mind-body approach to wellness. There's other things like guided imagery that they can mentally kind of take you to a relaxing place. There's DVDs out there. You can find them anywhere, Bed Bath & Beyond, anywhere, where you close your eyes and you just focus on, the sounds of the beach, what the sand feels like under your toes. Focus on relaxed breathing. When we're stressed, sometimes we don't breathe, or we just take short breaths. You want to breathe from your diaphragm. And that's something you can do even as you're driving, even as you're sitting in the doctor's office. Anything. It's very portable. These are things that don't have to take a lot of time. Listening to music. All these sorts of things. I put shopping ? Because that's something, it's a way I relieve stress, but then you regret it afterwards. So try to do something, that's a healthy way. But identify for you, even that warm bath, anything. And again, the City of Wellington, there's a number of wellness initiatives that you can take advantage of. Again, healthy things that you can do. If you don't get sleep or eat well, even if you're not a caregiver, you're going to be more susceptible to being irritable, to getting more stressed. So take care of yourself. All of us, maybe a glass of wine helps us relax. Having alcohol in moderation. But, being on the lookout for overuse of caffeine, nicotine, alcohol, these things that aren't the healthiest way to relieve stress. So asking yourself, how many people here are currently engaged in self-care activities, something to take care of themselves? Okay. According to your survey, actually, 50% of people who completed the survey do not participate in anything. Okay. Think about things that you can do for yourself after work. Think about things you can do for yourself during the workday, even if it's 5 minutes going outside to eat your lunch. If there's time where you're on your computer and you can listen to relaxing music, take those deep breaths. All those sorts of things are things to think about, just incorporating into the day. And sometimes you need to schedule these things on your calendar, or make a commitment with someone else. If it's going for a walk, it's easy to be like, I don't want to get up and do that. Well, make a commitment with a friend, and then you feel like you're letting them down if you don't go do it. So identifying what works for you, and if you have to, put it on your calendar. Ask yourself what things may interfere. Okay, I'm going to go for a walk today. It may rain. What's the alternative? Maybe go to the mall and walk, or schedule another day. Put the workout clothes in your car. Get yourself the nice bath salt so you take a bath. So asking yourself what interferes, but coming up with a plan. In terms of work, putting your role into perspective. Many of us think, if I'm not here, the whole company is going to fall apart. That's what we do. So take the day, if you need to take care of yourself, take care of your loved one. Be aware of your limitations. Practice good communication skills. As I said, take that time out during the day. The surveys show that people often use their lunchtime break times to take care of those caregiver needs. And you need to do that, but also try to use those times for yourself too. Self-care. And try to take short vacations, even if that's a 3-day vacation during the year. Just that mental breakaway really helps. But again, for so many caregivers, they're using that time to take care of their loved one. If you feel comfortable, talk with your supervisor. Share with them, and you don't know, maybe there's things we can do, and we're going to hear more about the benefits being offered, but maybe there's things that you can do depending upon your job position, being flexible with your time, things like that. So you don't know unless you ask, but you also have to feel like you have a good relationship with your supervisor, or go to HR. Again, seeing that the city is having presentations like this, programs like this, they're showing that there is a need and they care and they want to support. And again, there may be other things, and there's things like family medical leave that people don't know a lot about either. Okay, that's there for this reason. And again, we'll hear more about. So, do you want to talk? I'm assuming you're from HR, right? Do you want to come up and talk a little bit specifically about the benefits? Because, most companies offer benefits. We're not going to talk about all your health care benefits now. We're going to talk about benefits that will help you as a caregiver, including employee assistance, wellness, FMLA, that people don't know about.
Before you
Yeah.
go on, can I just make a comment about some of the signs and symptoms that you put up of stress? And I noticed a lot of them were like social and other things, but I had a lot of physical signs that came out on me. Which, I thought I was having a heart attack, I was doing all this other crazy stuff, and it was actually the stress coming out, manifesting itself in a physical thing on me. And it wasn't until later on, that I look back, and even now I recognise the signs after all these years ago. Wait, that's not really that. That's this.
Exactly. There are physical signs, and we're each unique in that. For some people, it's a headache. For some people, it's that racing heart. For other people, they feel it, in their stomach. For others, like I said, it's going to be that weight loss, not sleeping. So you know what the indicator of stress is for you. And the physical symptoms are so hard because they can be attributed to so many other things. You can think, oh, I'm just sick, or maybe my heart rate's up today, So, but all those things are important to, stress has emotional, physical, psychological, all those different components. So you're 100% right. And we're going to talk about the benefits, but then afterwards, I'm going to answer any additional questions you have.
Is how do you say it, alopecia?
No, it's a good question. Alopecia, and I have a flyer here. Aloe meaning the soothing properties of the aloe plant, sea, the calming nature of the sea. That's the program that Hospice by the Sea has. That's for all caregivers. And that's the program that's actually working together with the city and got the grant since we're focused on caregiving. And I have a flyer about all the services we have. And one of those things is we have, and it's on the flyer, an email address and a caregiver line. So if you have a question or you need a resource, again, there's tons of community resources out there, but if you even need that guidance on how to get to it, call us. My business card's there too, so you can email me directly, call me, and we're happy, to help. And again, we also do offer support groups, other services like that, and maybe if there ends up being an interest, it's something we can offer, here on site, because our closest one is in Boca. So, but we do education, training, all different things. But just know that there's someone that you can reach out to if you need additional information. Do you want to talk about the benefits, and then, or you want me to answer any other questions first?
I mean, whatever you want to do.
Okay. Well, any other questions? And again, if you're not comfortable, I'm talking in two mics. If you're not comfortable asking them in front of others, you can come up to me afterwards, or just call me or email me. Or if other questions come up afterwards, like I said, just get in touch with me, because I know it may be a little overwhelming, all this information. This was just meant to be a quick overview. Again, on each of these topics could be its own separate presentation. So, also give some feedback. If there's maybe a certain topic that you'd like to have more information on. I have a number of handouts that kind of address all these things. We're also going to be developing just a double-sided sheet that gives a quick summary of all these things, and then we'll be getting that to the city as well. So it's a quick reference guide of all these things. What is home health? What is hospice? What is respite? But for now, until I have that available, I have a number of handouts for you that you can take.
I don't know what questions that you have. I know that some of you have taken advantage of FMLA, before.
Give you the mic, because he's recording it.
He's recording it?
Yeah.
Okay, I guess I use the mic. I know that several of you have taken advantage of FMLA before, and just to kind of give a quick overview, has everybody been here at least a year? And you're all full-time, with the exception of one person. Once you've been here and you've worked at least, I think it's 1,250 hours, you're eligible for Family Medical Leave Act, and that could be for your own serious health condition or for the serious health condition of a dependent, or a spouse. You get up to 480 hours of leave, and that is to care for your dependent, your spouse, your child, and it's job-protected leave. So in other words, if you need to leave for 3 months because you have a loved one in the hospital and you need to give them round-the-clock care, you can do that and be assured that your job is protected for that period of time. We also offer a variety of time off options, PTO, paid time off, and MIL, major illness leave, accrue according to the number of hours that you work. So everyone in here, if you're full-time, depending on how many years you've worked here, the minimum you would accrue would be 6 hours per pay period for PTO and 4 hours per month of major illness leave. Now, you may be able to use major illness leave not only for your own serious illness, but it can work concurrently with FMLA. So if you are in a situation where you are a caregiver and you need to take family medical leave, you can actually, once you've met the criteria for PTO, you can use your medical illness leave to cover for that. Does everybody understand what's available to them in terms of FMLA and MIL? Some other...
I'm sorry, do
Yeah.
you take your PTO first?
Yes.
You empty that out first?
No, you don't empty it out right now, and we're looking at possibly changing the criteria, but for now, you need to take 8 hours of PTO prior to dipping into MIL. Again, MIL can be used for your own health condition after it's more than 8 hours, or if it can also be used concurrently with FMLA, if you've been approved for FMLA. The other thing that is offered to you is we have a wonderful employee assistance program. I don't think enough people take advantage of it. Alocia is here, and she's offered some great options for you. But sometimes you don't know what the employee assistance program offers unless you reach out to them. I've had very good experience with the people that I've worked with, either one-on-one to address certain individuals, or they were just here when we had a passing last week that was very difficult for a number of us, myself included. And I think that the caregiver or the provider that came, I thought that he was very effective. I mean, I know I felt better after I spoke with him. I didn't really get feedback from everybody else, but I think he did a good job. And I think that they offer professional services, and they can guide you if you don't even know where to start. So those are just a couple of things. If you have specific questions or you don't want to speak in the group, you can always come and talk to me, and I'll help you as best as I can. I'll give you whatever answers I can, and try to get additional information for anything I don't know.
And is everyone aware, I know you have a good wellness initiative here. Is everyone aware of the wellness initiative?
We have a great kind of self-starter group made up of employees, and they've done a wonderful job. They're actually the ones that reached out to this organization, and they're the ones that organized this meeting for all of you. But they did the one-on-one basketball. I know that they've done, there's something crazy, I don't know if that was last week or this week, like an 80s aerobics. They did boot camp. They've had a number of initiatives, and I think they've been pretty well attended. So they're doing a great job. If you have ideas, I think that Nicole McPherson is instrumental in that group. You could probably reach out to her if you have specific ideas or an inquiry into the wellness initiatives.
And depending on someone's position, is there availability of kind of flexible time or flexible hours?
For wellness initiatives, you can take, I think we say a half an hour a day if you want to use the gym. That would be like a break, and you are able to do that. Are all of you here, except for you two aren't here? Everybody else is here on location? Where are you located? Village Park? Okay, well, it's a hop, skip, and a jump. Exactly. Exactly.
If you hop, skip, jump.
Exactly.
And how about flexible time, just in general, for someone's job position? Do we have that if they're a caregiver?
We don't really offer flexible time. You know, I mean, if you needed to come in a little bit later or you wanted to, you know, change your lunch schedule in order to accommodate, I mean, it really depends. If you're on FMLA and you need intermittent leave, that's a wholly different situation. You know, certainly we like you to try to work it around your schedule as best as you can so that it works for you and it works operationally for us. But, you know, you should work closely with your supervisor in order to be able to do what you need to do.
Any other questions? Okay. Well, again, there's, you know, make sure you go to your HR department. They really can be a help. They're there to support you. Please come and take the handouts. There's a lot of good information. My card's there again. And again, I'm happy to help in any other way that I can. And, you know, thank you, you know, for coming today. And thank you for, you know, being caregivers to your loved ones. Okay. All right.